Hi, welcome to the Dr. Todd Show. On this episode, I have with me as my special guest Dr. Gene Sullivan from Sullivan Chiropractic in Chatham, Illinois. But today we're not going to be talking about chiropractic. We're going to be talking about the ChiroThin weight loss program, which is something that me and my wife Eugenia do in my clinic, Austin Family Chiropractic in Verdon. Is something you and your chiropractic assistant do in your clinic. I'd like to talk about that today.
Great.
So welcome to the show, Dr. Gene.
Thank you.
So next thing I'd like to ask you, Gene, is of all the different systems and programs available out there for weight loss, we've got the Jenny Craig's and we've got the Nutrisystems and we're bombarded with infomercials, and then we've got all the people with the network marketing products. Out of all these different things that people could be doing, some of them which they could totally do on their own, others which they would need a healthcare provider like us to assist them with. Out of all those things available, what attracted you to the ChiroThin program and why did you choose it?
Okay, that's a great question because, I've had a lot of patients ask me about that. I've had a lot of them ask why I started doing that here, because 20 years in practice, I have never ever endorsed a diet. Most of these diets, every one of them, you can find reasons why it may be unhealthy or they shouldn't do it. Whether it's going to be that they're going to be dependent on shakes for the rest of their life, with shakes don't fit every nutritional need that your body needs, or whether it be something like an Atkins diet, where an Atkins diet is very effective, takes the weight off, but it works by ketosis, which is very hard on the liver and kidney. You cannot stay on a diet like that long term. Ketosis is exactly what the body goes through in diabetes when it starts dumping sugar.
Yeah.
So when ChiroThin came around, really what attracted me to it was I had so many of my patients that had weight issues. They were having a lot of success with that in town at other facilities, and I'd watched them lose a tremendous amount of weight, and they were requesting more and more and more that I should have a diet here, that I should do this diet here. Well, once it became popular enough, I thought, this is ridiculous. It's effective. I either need to look into this and find out why this is not healthy for the patient and explain that to them, or I need to look at this, and if it really is something that is good for the patient, it's a way for me to get the weight off that these patients are looking for. They're looking for this type of a solution.
True.
So I did a ton of research. I went into it. What I liked about the ChiroThin program was everything. Okay, first off, that the drops that you take, the homeopathic drops, are 100% natural, and they have no side effects with any medication or with any other process that's going on with the body. Secondly, the diet itself is what blew me away, which is that it is exactly the kind of diet that we're trying to get our patients to do anyway. It is whole food, healthy food. It is actually gluten-free, dairy-free, sugar-free.
Oh.
They say that 85% of the population is actually gluten intolerant and don't even know it.
True.
And so, one of the great things about this diet isn't just that it gets the weight off, but it teaches people how to eat correctly. This is how you should eat long-term.
Yeah,
and it also, the way they come in and the things they tell us outside of the diet about just how they feel is amazing.
Wow.
So anyway, once I went and I researched the diet, got all the information on it, it is low calorie at the beginning, which is a concern for a lot of people. But if you look at the research on that, they're actually recommending these low calorie diets because they're very, very good. Healthy cells reproduce faster. The inflammatory T cells in MS actually die under these kind of conditions, and certain cancer cells do too. And so the New York Times, the Wall Street Journal actually did an article on this and produced a video on this. And so they're recommending that people go through these low-calorie diets a few times a year, not even for weight loss, just for health reasons.
Okay.
So everything about this diet is something
like
I
a
think is healthy.
detox, probably.
Yep,
Okay.
exactly.
All right. Okay. So and my wife is gluten-free. Her nickname or hashtag whatever is gluten-free Gina. And she's been gluten-free since 2013, August of 13, and she's got issues with gluten, totally got issues with gluten.
A lot of people do.
So this was something that she looked into and she tried and lost like 26 pounds on it.
Yep.
Tried it again, lost another 26 pounds, so
Yep.
that's pretty awesome.
Well, and that's like, Sarah and I both.
Yeah.
Also, not only did I decide that this was a very healthy diet to do, but then I tried it out on ourselves and our family.
True.
And
Yeah.
I took 20 pounds off in 2.5 weeks.
Wow.
Sarah took 26 pounds off in 6 weeks.
Oh, wow.
And that's the great thing about this is that it is so effective. People see results fast, so they stay motivated.
Oh,
you
yeah.
know, and that's a key to it too. Is, you know, if you get a person motivated, they can take the weight off.
True.
Yeah.
Yeah. And the last question I have for you today, Dr. Jean, is can you share with me any unexpected good side effects, such as symptom relief, that you've noticed on your patients that are going through and doing the ChiroThin program?
You know, tons. And that has been one of the unexpectedly fun things about doing this diet, is we expected to be able to help the patient get the weight off. What we didn't expect is almost every single high blood pressure patient we have has greatly reduced their medications. Most of them have even been able to come off their medication.
Wow.
That's by their medical doctor, not something we're trying to make them do. It's just that their blood pressure keeps getting lower and their medications get less. We have a few diabetic patients that have gone through this. Their sugar level's unbelievable.
Wow.
And then you have the other things like we have a fibromyalgia patient who she has had 25 years of severe chronic pain. I've talked to her about gluten in the past, and you know, again, they just don't know where to start with that. So, you know, going through this for weight loss, within 3 weeks, all of her fibromyalgia pain was gone, and she is staying on this
Wow.
diet long term just for that reason, let alone that she's lost 40 pounds on the diet.
Yeah, that's totally life changing.
Yeah, absolutely. We got a patient on, as we talked about the knees earlier. Well, his knees was not a reason he came in for it. He's had chronic arthritic knee pain for years. But within 3 weeks of him doing the diet, his knees stopped bothering him, and he's golfing, and he is just thrilled to death that he's not dealing with those kind of pains. And you know, one of the things that kind of impressed me at the beginning is I had this thumb issue, and I am, you know, a very healthy person. I never had any complaints at all, and I had this chronic nagging thumb issue, to the point that we had scheduled laser for you to come and do laser on my thumb, and we were going to do that. And just by coincidence, I started this diet a few weeks before we were going to do that, and within a week and a half, my thumb pain went away, and I'd had that for 4 months. So that's the other thing about this diet, is by being gluten-free, dairy-free, sugar-free, it's a non-inflammatory diet, and
Yeah.
you know, rheumatoid does well with that, and you find all these other inflammatory conditions do fantastic. So lots of side effects to eating healthy.
So I never even had to do laser on his thumb.
Yes, yes.
So it healed up with the ChiroThin
That's right,
diet.
which
So
was
yeah,
which
it
was
was
great.
pretty awesome. I want to thank you for being on the show today,
appreciate
Dr.
it.
Jean. Lots of awesome information. Continued success with the ChiroThin program in your clinic.
Well, thanks, and to you too.
Thank you.
You bet.
And thank you for watching.